Today we're going to demonstrate our new elbow UCL reconstruction using knotless fixation. Here we have started the approach, and you can see that we've removed the native UCL ligament, and then we identified the sublime tubercle. We are protecting the ulnar nerve, and you can see we've tagged it more proximally. Once we identify the sublime tubercle, we place a guide wire more than 5 millimeters from the joint line. Then we will use a 5 millimeter reamer. We mark a depth of 15 millimeters. Once this is reamed, we'll clean out the hole and make sure that we have adequate depth. Following this, we'll use a fork tip 4.75 swivel lock. This is a palmaris that we've already harvested. Again, there's also a suture tape in here as well, which will be used for the internal brace. The key here is to make sure that you hold both sides of the tendon so you can recreate this double bundle technique. We engage the 4.75 swivel lock, and we also have the suture tape as well. Removing the swivel lock, you can see that we'll test out the strength, and you can see there's excellent fixation, and the tendon is exiting on both sides of it. Here you can see we're going to recreate a double bundle. We bring the arm to 30 degrees, and we'll mark roughly where the insertion point will be for both of these tendon limbs. Following this, we'll turn our attention towards the humeral side. Again, in preparation for healing, we will remove the native ligament tissue from the insertion site. The key here is to stay more towards the epicondyle and less towards the joint line. People have a tendency to be too medial. We place a guide pin. In this case, you can use again a 5 millimeter reamer. If the tendon is larger, such as a gracilis tendon, you can go to a 5.5 reamer. Here we're going to do a depth of roughly 18 millimeters. As we're not going to be using the fork tip, we'll be using a standard 4.75 swivel lock. Again, we will bring the arm to 30 degrees. We'll mark out the entry point. And again, we want to make sure that we do not bottom out the tendon. We'll use a suture tape and whip stitch this for roughly 12 to 13 millimeters of tendon. Once this is whip stitched, we'll truncate the graft, and we'll repeat this for the second limb. Following there, so we'll take the native ligament underneath, as well as the two other ligament strands, and we'll mount them in with the 4.75 swivel lock. You can see here the tendons have dunked very well, and there's excellent press fit. And there is no wrapping of the tendon. Following this, we will truncating the remaining sutures. You can see here we still have tagged our ulnar nerve for transposition later on. We have excellent tension at 30 degrees, and there is no overconstraint at full extension. We'll bring the arm to 30 degrees, and here we'll tie alternating half hitches, the tapes together for an internal brace. Following this, we have now not only repaired the native tissue below, but we have actually done the reconstruction, and then we will repair the entire joint capsule. This will, one, prevent the internal brace as well as the native tissue from windshield wipering, and it combines the entire construct. This is fairly standard with the majority of our new UCL repairs as well. Now you can see that we have excellent tissue. We've remade this ligament reconstruction, and we are stressing it. You can see there is no gapping. And we have excellent fixation on both sides with a double limb. If a triple limb is needed, you can bring it back over as well. Thank you.